Yeah, no strikes.
Why am I fucking white? Why do all of us look the exact same? Fuck.
I wouldn't say everybody.
Welcome to clone medical training.
You're the one motherfucker. Why? How?
Alright. Everyone got the kit?
Among Us.
Alright, good stuff. Alright. Is everyone here or waiting on someone?
A couple just loading.
No, I believe we're good. Alright. Welcome to medical training. This is based on CAT Medical. That's what we're using. However, we're not using the everything it has to offer. Some things are disabled. Just to keep it not too advanced. Good balance between medical engagement and
Okay.
interesting treatment and patient's downtime.
I want to have someone down 85 minutes.
Was that?
I say you don't want to have someone down for 2 hours.
Exactly. Not fun at all. Quick disclaimer. Personally, I got no outside of game, got no medical knowledge or experience, so don't expect me to get terminology wrong or something. But it's all based on experience, just testing, reading, in the game. So that's a quick disclaimer. We start off with the medical menu. If you all press H. Did the medical menu open for all of you? Yes? No?
Yeah.
Yeah.
Yes.
Alright. Good stuff. Right, we'll go through it. First thing you check when you open the medical menu, check the name at the top center. Just make sure you have the correct target. Either if you need to treat yourself or the patient, so you don't accidentally treat someone else or AI or something you're meant treating. At the far left, you have the triage card. That'll be empty right now, but in there you'll see whatever's been applied to the patient, any medications pushed. It's good to check just to prevent giving too much pain suppression, for example, pain relief, or some overdosing. I know some people like that, but it's not ideal. Second, you got the examine patient, the magnifying glass. In here you'll find anything you need to find regarding checking stuff like checking pulse, checking blood pressure, checking heart rate, checking or applying pulse oximeter. Anything you need to investigate or examine, you find on this tab. And if you select any body part, you'll see it will change the options you have. This applies to all categories in the medical menu. And I'll go over that later actually. So moving on. If you select an arm or limb or torso, limb, you can select a limb. You have the bandage and fracture category. In here, this itself, it's if you find the bandages you're using, the tourniquet, and also applying splints to broken limbs. Moving on, you got the medications tab. You can select the head and press medications. You'll have a couple of options there. Yeah, as it says, this is where you find all the medications you're pushing, whether it be through IV or auto injectors. or pills. Or the Penthrox inhaler, for example. And moving on to airway management. Here we find anything in regards to airway. This is where you, for example, if you select the torso, you can apply a chest seal. If you have the head selected, if it's needed to manage the airway, here you find the LSTs, the Gadel tubes, whatever you need to manage the airway, you'll find under this category. Also, when you're treating pneumothorax, anything like that, you'll find it in here. Moving on, you have the advanced treatment. That is grayed out now. We don't have anything we can do with it, but here we find any advanced treatments. For example, you find doing the CPR option in here and using the defibrillator, applying IVs and IOs, stuff like that. After that, you got surgery tab. It's a couple. We don't have, for example, advanced fractures turned on, but there's a couple things that we use that fall under this category. But I'll get to that later. After that, you got the drag and carry. Yeah, you can drag and carry people either through ACE interaction or you can use the medical menu. You have that option. And the last thing is the switch target. So if you turn and look on a body and press H, you open the medical menu and you see his name, whoever you're looking at. You then press that switch target, it will target yourself. And then you can switch back and it will target whoever you're looking at. That's good to use if in case you need to check yourself real quick. And then you don't have to turn away. You can just press that and check if you're injured or something. Everyone with me so far? Any questions?
Thank you.
Everything good.
All good so far.
Oh, good.
Good stuff. Good stuff. Then you have the body parts. So you can select torso, limbs, head, whatever. Sometimes a tip is it's actually better now, but a tip is you press the outer edges of the body part. That prevents like accidentally choosing the wrong body part. For example, sometimes you meant to click the arm, but you select the torso. So just aim for the outer edge. It's make sure you get the right limb. On the right, you have the overview. This is where you get all the information. You got some universal information like no bleeding. They'll tell you otherwise if someone's bleeding, it will say the severity of the bleed and as well how much blood has been lost. Now it also says no IV. Otherwise, it will say when you have that limb selected, it will tell you if you have an IV applied or inserted. And yes, this is where all the wounds pop up as well, as you've seen before. It'll also tell you if there's any pneumothorax present. There is a hardcore setting to have the pneumothorax not show up in this overview. You actually have to diagnose that, but right now we have it set to it will show you right away if pneumothorax is present. Yeah, there's some more things popping up probably, but can't remember right now. Below the body, you have it says none. If you press that, you have a drop-down menu. It has a triage card or triage. It's good to use sometimes if you have multiple patients. Yeah, I'll go over that later. What's good to set? In the top right, you have IV flow control. Everyone see that? Yeah, if you press that, you have menu popping up on the left, and that'll tell you where you have an IV placed, and if it's an IV or an IO. We'll see that later when we apply IVs and push fluids, that you have to open the line when you have established an IV. Otherwise, it will just sit there and there's no flow. So you need to open it up. The max value is 1.5. You just bump it up to the max. Right now, there's no reason to fiddle around with the amount of flow going through. You can just max it out right away. Further down the line, if we enable that, there's some reason to have to not push some fluids too fast and too much. But that's not relevant right now, so we'll skip that. I believe that's it for the medical menu, unless anyone has any questions.
No.
Oh, all right. In your kit, this is everything you need to prevent someone from dying, unless they're suffering pneumothorax. You can't do anything with that. But in order to save someone and potentially get them back up on your feet, the only thing you can't do is, as I said, treat pneumothoraxes and push fluids. This kit is just meant to show what you can do if you don't have all the tools. And we'll do some testing in a minute. Right. Let's see here. Actually, I'll get that out of the way right away. Just to very first step, how do you tell if someone's KA? Anyone know?
Response.
Yeah. Yep. You used to be able to yeah, but severe cyanosis is just that it's at a dangerous level, and that severe cyanosis will show up if you have a tourniquet on the limb as well. If you target the head, though, that it can say severe cyanosis, but it could still be alive when it says that. Used to be able to judge that if someone's KA by not being able to drag or carry them, but the recent ACE update changed that, so now you can drag and carry dead bodies. Fatal blood loss, you can still be alive having that, but you're give or take, or more or less 30 seconds away from dying. That is a good practice to, if you come up on the patient and you see the fatal blood loss, before you do anything else, you do a quick check. I'll spawn in the body so you can see. Give it 2 secs. So this is my primary patient usually. NATO ammo bearer. Gone through so much shit. Right, if you walk up to him now and you open the medical menu, select his head, go to examine tab and response. Then you see not responsive, motionless and cold. Cold being the keyword. If he would be in cardiac arrest, it would say not responsive, convulsing, and something else. And if he's just unconscious, it says not responsive. Yeah. So then you know, right, I don't need to waste my medical supplies on this guy, he's KA. Then you can, if you use a drop-down menu underneath the body, yeah, exactly, set him as deceased. Stuff. Then you know how to tell if someone's dead or not.
Yes, sir.
Right. So I'm sure some of you are maybe familiar with the acronym SMARCH. Anyone heard that before?
You said
I heard you say it the other day, yeah.
Yeah, SMARCH. SMARCH.
Nope.
Well, it's acronym stands for security, massive hemorrhage, airway, respiration, circulation, and hypothermia. Hypothermia is irrelevant. We don't have that enabled, so don't need to worry about that. But basically, this is a good thing to follow when you're treating. Starting off, obviously, with security, make sure you and your patient are in cover and that your team is providing security. Otherwise, just things will get worse.
Can't save someone if you're dead.
What, sorry?
You can't save somebody if you're dead too.
Yeah, exactly. Massive hemorrhage. First step, stop the bleeding. Doesn't matter. Anything else doesn't matter if you dude's out of blood. Any ideas what we could use to stop the bleeding?
Tourniquets.
Bandages.
Perfect.
Bandages.
Anything else?
Quick lot.
Yeah, it's a
TXA.
type of bandage. Yeah. Medication, TXA, perfect.
Chest seal.
Yeah, it's good for airway treatment, yeah. There is some, no, I'll take that later as well. Right, so that's the first step. Second step, airway. An airway could become occluded, or there's an obstruction. An idea is what we could use to solve that.
King LT.
Yeah.
You trying to preserve it or just get clear?
Oh, sorry?
Are you trying to preserve the airway or just clear it?
No, both clear it and preserve it. Go for clear it now. Let's say there's no occlusion.
You help her extend the head, then you do head turning, and then you put in a king LT or a Goodle tip. And then
Yep.
if you need suction, you can use a Acuvac.
Perfect. I'll tell you what. Get a patient in and just go through here.
That
Give him
guy
a
doesn't
sec.
look
Give
very
him a
good.
sec.
There
Yeah.
we go.
Straight from hell. Alright, this one is too bad. Right, so first step. Security, we're all good here in the base. Massive
Like
hemorrhage,
security.
bleeding, yeah. Alright, stop the bleeding. You can use tourniquets, bandages, whatnot. We slap on tourniquets now on his limbs. Anyone feel free to do so. Good stuff. Alright, hold up. Don't need to put tourniquets on limbs that are not injured. Right leg is doesn't need a tourniquet. So stop the bleeding. Now we check the airway. Already on that, both obstructed and occluded. Now, what's
Now,
the
once
downs?
it-
Oh yeah, go ahead.
I was just saying, once we get to that blue color, we're gonna take the turnies off, ain't we?
Yeah, you can.
Alright.
Just keep in mind, as long as the wounds are bandaged, there's a chance of them reopening at some point. So
Gotcha.
eventually the dude's gonna need a stitch. What's the downside with hyperextending head?
No idea.
Who is doing the hyperextension right now? Who did it?
Come on, boys, talk up.
Stag, you did it right. Hyperextension.
Well,
Yeah, if you back away from the body right now.
it cancels it.
Yeah.
Yeah, so you have to stay closer.
Exactly. Picture that you physically holding the head and tilting the chin back to keep the airway open. If you let go and walk away, it's not gonna stand or stay open. So that's something to think about. Well, this guy woke up fairly quickly. But yeah. So if you have occlusion, you can use the head turning. You can use the AccuVac. Obstruction, you can use the hyperextending head, or you can use a gated tube, or King LT. The difference between gated tube and a King LT is the gated tube will only prevent obstructions, but if the dude pukes, the airway will become occluded. The King LT, given that you have cleared the airway from occlusions before putting the King LT in, is that it will prevent any further occlusions. So it will prevent any puke or blood from blocking the airway. So clear the airway of occlusions and put in a King LT is a good way to go. Then you have the airway secure.
Is it an accident that we don't have King LTs in our kit?
No. This kit you have on now is to demonstrate the very minimum you need to save someone and keep them stable, potentially be able to wake them up. The only thing this kit doesn't have is you won't be able to push fluids and you won't be able to treat pneumothoraxes. I'm gonna have another kit in a minute here, but just wanted to demonstrate the very minimum you need and the methods you can clear airways without tools. Yes. Any questions on that so far?
Negative.
Alrighty.
Oh, just a quick one. I've got a quick one.
Yep.
Do the fractures don't bleed on their own, do they?
No, fractures does not cause bleeding. No. No, the only thing you have to do with fractures is just apply splint, and you're good to go
Yeah.
with the current settings we have. Right. Moving on from airway, got respiration. Give me a second. Sorry.
I feel like the white girl in that video.
What video is that?
Never mind.
So, there's three things you're fighting when you're coming up to a patient. Number one being bleeding. Number two is the oxygen saturation, SpO2. It has some different levels. You got the if you're sitting at 75, 75, you go into cardiac arrest. If it falls below 65, you'll die. The third thing being the cardiac arrest timer. If someone's gone into cardiac arrest, you have, not mistaken, the current setting is 10 minutes. So those three things, you got the bleeding, people can bleed out, you got the SpO2 level going too low, and you got the cardiac arrest timer running out. That's the three things you need to worry about we're on respiration now, and pneumothoraxes are one thing that can fuck up the SpO2. Got some different ways to treat the pneumothoraxes. You got the chest seal. That is all the first thing you start with when you have a pneumothorax. And chest seal is all you need for just a regular normal pneumothorax. If it has advanced to second level pneumothorax, tension pneumothorax, you have a needle decompression kit or an advanced airway kit. You can use either one for that one. And then you have a hemothorax, which only the advanced airway kit or the AAT kit can solve or treat. I'll get a new patient in 1 sec. Yeah.
Irma. There we go.
That is a little bit creepy.
Hey, he's good.
It does it because of the props on the floor, the mat
Yeah.
and stuff. Tries to put it on the ground level, but it can't.
Alright, so you can go ahead and bandage his head and leg. Do not clear his airway. Just leave the airway. Someone apply a or
I'm gonna have to
attach a.
step away for a second, boys.
Yeah, no worries, man. Someone can apply a or attach a pulse oximeter on his right arm. Perfect. Oh, perfect. So, as you can see with the pulse oximeter, it tells you the pulse rate and the SpO2 level. Pulse rate saying 0 right now. Means person is in cardiac arrest. Hence, there's no breathing going on, and the SpO2 level will decline. If someone checks the airway, and see what we have. Not obstructed, is occluded. Right, so you can clear the airway. And it'll still decline since there's no breathing going on. When you have, did I put that in here? Oh, everyone hear that? Yeah, check the area again. It's occluded because he puked. Now, if you go to select the torso and go to establish or advanced treatment and establish recovery position. Right, so this has cleared the airway and it will stay cleared when someone's in the recovery position. The problem with this is we've seen that he doesn't have a heart rate. You can't conduct CPR on someone that's actually. Oh, it will cancel automatically. Okay, yeah. So you can't conduct CPR on someone that's in recovery position. So when you start CPR, it will cancel, and the airway may become occluded or obstructed again. So this is a good situation to, when you clear the airway, to put a King LT in, so you can keep the airway clear and continue working. So if I want to clear the occlusion and put in actually we don't have that in this kit. Sorry. Right. If you start doing CPR, Someone go ahead and do so. So the SPO2 level will keep declining even though we're doing CPR. But there's a tool that we use in combination with CPR called the bag valve mask, or BVM, pocket BVM. Basically, it's the you may have seen that you put it on the patient's face, and it's a bag you what's it called? Squish, yeah. And when you use that, it will raise the SpO2 level slowly. If the person has pulse back, it will boost the SpO2 level, increase a little bit when using the BVM. There may be situations where you get a pulse oximeter on the patient and you see the SpO2 level being dangerously low, around 70 or below that. You know it's you don't have a lot of time left. This situation you would need to have some assistance, one doing CPR and one doing the what's called, failing me, but the breathing with the BVM, just to raise that SpO2 level high enough so you can get to work on further treatment without the patient dying. Stop CPR, see if he got the pulse back maybe. He does, it will slowly rise, but he does. And you see on the head the slight cyanosis. That's since it's sitting at 90 SpO2 level, below 90. So if you check the head, go to airway management and check breathing, you'll see that the patient is breathing now. Oh, he's not.
No.
Check
Not
the
any.
airway again. Yeah, check the airway.
Occluded.
Occluded. Let's clear that and then check the breathing after that.
Shallow breathing.
Yeah, good stuff. And now, since he got a pulse back, he's breathing, the airway's clear. We can put him in establish or in recovery position. Go to advanced treatment, select the torso, and put in recovery position, which is in now. And now we just wait for his return. You can use. You could try and if you select the head, go to medications and reorient patient as a slap. Should be able to wake him up. Might take a couple tries.
I love that noise.
Where's the fucking medic slapping this guy?
There we go. Usually takes if he's at the ideal value when it comes to heart rate, usually takes like one slap, but other than that takes 3 or 4. If you kink it takes 11. I forgot to show you guys.
I'm awake. I'm awake. Shh.
Not quite yet. I'm sorry, I forgot to point to this. Just ignore the bottom left screen right here. That's outdated. Right one though.
Sorry, fast kill.
Yeah,
I
no
never
worries.
got round to uploading it onto the server. I can put it
Yes.
in chat for you though if people want to see it.
Yeah, I could do actually. Yeah. Right. So, essential values. You got the ideal set of values at the top. Heart rate 80, blood pressure 120 over 80, and oxygen saturation 100%. That one is changed now. It's like if it's sitting at 97, it's good. That's the default value. So to wake someone up. Stable set of values. 85 or above in oxygen saturation. He's at the first blood loss stage, lost some blood. Heart rate is above 40, and blood pressure is above 60 and above 50. Then you should be able to wake someone up. You see here in the should stop skipping. After that, you got the critical set of values. You got the lethal saturation, 65%. Yeah, you can see what it says. The ones to keep track of is really the saturation. Just remember that. The blood loss, you got the lost the fatal amount of blood. That's when you know patient is about to bleed out if he hasn't already. Yes, if you look at the successful carbonate use requirements, you're looking at the systolic value of the blood pressure, which is the higher value. Most of the time, when you have treated someone, you're about to wake them up. Usually their heart rate is elevated, which put the reorientation is not going to succeed. So it's better to go with carbonate because usually the blood pressure is around 100 to 140. Unless you see the heart rate sitting at 80, you can go for the slap just to save the carbonate pills or carbonate medication. By the way, I will refer you to the CAT official guide where you got plenty of information. Everything you need to know is in there. I'm not gonna run a bunch of slides or show you a bunch of stuff like that. I'll pick out the most important bits, I thought. Yeah, so when you want to deep dive in that, you got the guide for that. You got all the stuff you need. You can go ahead and go to the arsenal. And you can pick up the public loadout training medic stage 2.
Pascal, that document's in armor chat if you need it.
Oh, perfect. Thank you. All right.
Zero, you don't need a gun, mate. You can put that away.
Guy's gun
Right.
fucking wounded.
If you
What
come over
happened
here
to
when you're
you?
ready.
Guys, you don't need to be changing our gear. Let's just fucking take the kit and join in.
What are we
So,
about? What are we doing with the guy in the middle?
about to see. Oh, whoops. My mistake. Right, let's see here.
Lost a lot of blood.
Can someone tell me when it says fatal on this guy?
Lost a large.
Large amount. Okay, let's see. Okay, perfect. Right. So, circulation. Got the cardiac arrest. You can use CPR or AED, ADX. The difference between the AED and the ADX, the defibrillators, is the ADX. You have the ability to monitor vitals as well. You got the the vitals monitor, yeah, which is the one I prefer to use. Right. So you see, he said fatal, right?
Yes.
Come back to large now.
Yeah. So that is the body compensating for the blood loss.
Yeah.
It's recruiting fluids from I forgot the name of it, but certain spaces in the body. I forgot what it's called now. But anyways, it can compensate a little bit for blood loss, right? So, and if you've stopped the bleeding, it will be able to compensate quite a lot. But yeah, I'll try to put it down to fatal again.
Coagulation. Is that what you're trying to say?
No, it's not coagulation. This is
Great, brilliant.
fluid
No,
shifting.
shut up.
It's called. It's basically it's recruiting fluids from the interstitial space or something. It's called.
Let's just say vital organs.
Yeah, yeah. Let's see. Let's say fatal now again.
Yeah.
Okay, right. So go ahead and use the AD. You go to advanced treatment. Actually, before you do anything, if you go to advanced treatment, you have charge defibrillator, remove defibrillator pads. I'll charge the defibrillator pads now. You have the sound, and you see the option pop up in a minute. Administer shock. Now is everyone looking at the medical menu?
Yep.
See this guy?
Yep.
Is everyone in pain right now?
Yeah.
Yep.
Yeah.
So get clear of anyone receiving a shock from a defibrillator.
Is it worse if you're doing CPR on them?
You can't do both at the same time. You can if you're doing CPR, you need to pause that in order to send the shock.
Yeah.
So it's good to if someone's doing CPR and someone's preparing the pads, and the guy lets everyone know when it's been charged or charging pads with the defibrillator, then say get clear, and you just can close the medical menu and will administer the shock, and then you can get back to it. Now, if you go to select an arm and go to examine patient, you got view monitor, and that will open up the actual
Oh, well, yeah.
AD. And you got the big shock button on the
Yeah.
right, charging, cancel charge, analyze rhythm. But all we see now, there's no pulse, no cardiac activity. Now, if someone wanna connect vitals monitor, see that option in the arm there. Right, so now you see flashing red in the bottom. You got the heart rate 0, blood pressure 0, SpO2 93. When someone's in a larger fatal amount of blood, you will not be able to get the heart going, no matter what you do. So you need to push fluids and get them out of that stage before you can actually get the heart going. For example, now fluid shift has put him up to lost a large amount of blood, and so now we technically could get the heart started. But when he gets his heart rate back, it will be very high, most likely, when they lost so much blood. So yeah, go ahead and push fluids. You go to advanced treatment and you select the left arm, which has an IV in it. You see the fluids pop up, whatever you carrying, blood, saline, plasma. Right now you can carry whatever you wish. They all work the same. Down the line we might change settings or whatnot, and then you'll most likely be using blood or plasma preferably. Saline would be not as good, but that's irrelevant now. So you see you push the bag, or place the bag, 2 bags even, nothing's flowing. That's when you need to go to the IV flow control, open the line up, max it out just like that, 1.5. Then you can keep the flow control open. There is a chance for IV to become blocked. Most likely when you, for example, push TXA or EACA at the same time pushing fluids, the catheter might get blocked. To clear that, you can see if I can get it to block here. Push EACA and TXA. I can go through those medications as well. The TXA it promotes blood clotting. So that means it will start to bandage wounds by itself. And it will keep going until there's no more wounds to bandage, or the timer runs out. I think it's 6 minutes or so. Stays in the system. The EACA is medication that will stitch bandage wounds. So these medications are good when the patient has a lot of wounds and there's a lot to handle. The IV doesn't want to get blocked, seems. But to clear a blocked IV, go to advanced treatment, select the limb that has the IV. You push give saline, so you should always carry a little bit of saline. And then you'll have an option saying saline flush, and that will flush the line, and it will resume. What's called flow will resume. If you go to the examine tab, still having the arm selected with IV, you have inspect catheter. Click that, and it will say in the top right if it's the IV is clear or not. So you see now we have the SpO2 level is dangerously low. So if someone want to go ahead and do CPR, and someone else, select the head, go to airway management, and use pocket BVM. SpO2 level is currently at 74. Opti, after you're done at ACVAC, you can put a King LT in. Right. The 2 is increasing, 73 now and climbing. $25. So if you hold CPR, use the AD. Try and get the boss back.
No shock advised. Analyzing now. Stand clear. No shock advised.
You can ignore that. No shock advice. You can just go in and shock him.
Shock him. Yay.
That is for when you have advanced rhythm enabled. There's certain cardiac arrest types where you can't use the AD. You have to use CPR initially. Right, so what do you say before you hit the shock?
Clear.
Clear. Everyone get clear. And shock. You also wait, takes a couple seconds sometimes.
Stand clear. No shock advised.
Go ahead and shock again.
Clear.
Clear. Alright, before you shock a second time, or before we shock now, any ideas what we could do right now?
Epinephrine?
Yeah, exactly. Go ahead and push 1 times epinephrine. So epinephrine will increase the success rate of AD and CPR. Also boost wake up chance.
In.
Alright, Epin, go ahead and do another shock.
Clear.
Go ahead and shock. Very reluctant to get up. Give me a second.
No, we got one. We got one.
Oh, you got one?
Yeah.
I think someone started doing CPR now.
Oh.
Yeah. Try again.
Clear body.
Clear.
Shocking, shocking, shocking. I think this one's dead there, sir.
Heart rate.
There we go.
Yeah, pulse. It's 200 beats a minute, but it's a pulse.
Yeah.
It's okay. We can bring it back down. Just let it be. There you go. Back to 94.
Yay.
Good stuff. So what were the conditions to wake someone up? Oh. He woke up by himself. Good stuff.
Time.
Right. So which conditions do we need to wake someone up successfully? For example, in regards to blood loss.
Yellow.
Yeah,
Yellow
needs to
blood
be
loss.
sitting at the first blood loss level. Lost some blood. Alright, SP2 level. What did need to be at in order to wake someone up?
90 or above.
Almost 85.
85, yeah.
Yeah, 85 above. Alright. Alright. Any questions on that circulation or?
I have a question, but I don't know if it's what you were going over.
No, go ahead.
In the oh Christ, where's it gone now? The dressing vacuum.
Yes.
Is that the equivalent of bandage a whole bunch and stitch, or?
Yeah, it's like a a personal aid kit for one body part.
Gotcha.
And I'll go over that. So, this dude
Sorry
doesn't
if I
have
jumped
any.
the gun a bit.
No, it's fine. I'm actually gonna go through some equipment now. But quick rundown. Actually, who wants to be volunteer and take care of a patient?
I'll do it.
All right.
I feel like I'm gonna regret saying that. Oh, my target. Arma,
All right. Here is.
get him up.
And go through the stages you're doing.
Tourniquet off his leg, prevent bleeding.
Yeah.
Same with his arm. Apply bandage, stop the bleeding.
No, you don't need to. You stop the bleeding already by applying tourniquets. And since it's not bleeding from chest or head, there's nothing to bandage. You can go straight to airway at this point.
Checking airway. Truck dead.
Sound like you puked. Take airway again.
Airway is obstructed. Airway has occluded.
Yeah. So, first thing you gotta do is clear the occlusion.
Occlusion removed.
And if you puked once, you can puke twice, right? So, what do?
Recovery position.
Yeah, you could put him in the recovery position. Yeah. Right, so that's airway done. What's next?
Bit of a help. Okay.
Oh.
Hey! He's awake.
Yeah. Yeah. What's the after airway? What was the next step?
Finish bandaging his arms.
Now, if you do the things march.
Circulation.
No, the one before that.
Airway.
No, the one after that. Respiration. Right. So basically, it's just the
So he is breathing shallow.
yeah, just breathing or the SP2 level. By the way, if you have someone like this that you didn't have to tourniquet both arms, you can put a pulse oximeter on pretty straight away. You instantly get an idea if it's got cardiac arrest and what the SP2 level is at. But you got a vitals monitor on now, so that's good. After respiration, you got circulation. He had a pulse and he woke up, so good. Kind of easy patient. Right. We'll crack on. Time flies. Any questions or anything you feel is unclear or I could explain better? We all good?
You doing good,
Yeah.
boss?
Okay, good stuff. Right. So if you all go to the arsenal.
Get him first.
And go ahead and pick up It's ace interaction and
Not liking me. There's nothing.
oh, I'm sorry. Never mind. We don't need to grab anything from Arsenal. Actually, had everything on us. Right. Okay. So we go through some of the advanced equipment. I'll tell you what. I gotta go and check on the kid real quick. I'll spawn in a couple of patients, and you can work on them in the meanwhile.
Let's
I
touch
actually gotta do
people.
something. I'll be right back.
Yeah. No worries.
Aha, amen.
All right.
I'm gonna grab myself a potion. Where's my guy?
You checking the
There he
airway?
is.
Donk?
There he is. Okay.
Nope. Still trying to get into there. Not really the best at the ace interaction menu right now.
Array abstracted. Obstruction removed. Check breathing. It's not breathing. Check airway.
Hands up.
All right, I'm back.
Welcome back.
How are we doing?
Oh shit. Still bleeding.
This
Put some
man
bandages,
just
Donk.
needs
Put some
blood.
bandages on the legs and on the left arm,
He is
please.
running
Your hand up, D?
Okay.
I don't think I'm okay, mate.
Yeah.
I'm sure I can take the tourniquet off and then I'll get him up.
Take the blood, sir. Trust me, it's good for you.
Oh,
Yeah, I got fun one.
Put one back on. I'll take it off.
La 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 la. Boop. La 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 la.
Now we just slapped the shit out of him.
I'm not waking you up yet, sir, because you're kinda fucked.
I think your singing will help.
How do we slap him in the face
Oh.
again?
Like, you might keep
Hang on,
him,
let me
might
see
keep him
what-
asleep.
Just select the head and
Rude.
go medication.
My singing woke Delta up mid up
How
yesterday.
do we
It was
slap him?
it was fine.
What have you said?
I don't know, there might have been you sitting on his face.
Actually, yeah, I'm about to bring that up in a
True.
minute.
I was sat
That's
on
right,
his chest
nice.
for
Yeah.
a long time.
Used one on this guy.
No shock advised.
No
So I'll
shot
go through the.
I did
Why
something.
don't we shock the guy who
I'll
doesn't
start
need
with
it?
with that.
What's that?
It's
I
all
did
right, I
something.
just had to step away, so I didn't. I
You did
missed a bit of
something.
what you said.
Yeah, yeah.
Yeah.
All right.
Scared.
Here's what happens when we shock somebody who doesn't need to be shocked?
I like Delta's answer.
They risk going into cardiac arrest. Really, there's a chance for it to happen.
Ah,
Uh,
sir, you're not fixed. Don't go anywhere. Sir, don't move. Can
Do
you
it.
remove the gun from your kit, please?
Put the
Zero?
gun away.
Jesus.
All right.
Sir,
So
I appreciate the fact you put your ass in my face, but you're not good.
Whoa,
Go
whoa,
anywhere.
whoa! What did you just say, Trax?
You heard what I said.
What the fuck you just say?
I am treating this man. Step back. He is now fixed. Give me my defibrillator. Fast kill. I
Yeah, he's a-
present you one man.
one man. Harvey Turner. Good stuff. Very good, very good.
Hey, second.
Yeah. Just needs blood. And that case up. Good stuff. Alright. If you yeah, you can just wake that guy up as well. Tapping your carbonate. There we go.
All
Good
right.
stuff.
Oh,
Good
he's
job.
bleeding again. He's bleeding again. He's bleeding again. Okay.
Okay. If you go ahead and look in your inventory, you have in your backpack the surgical kit as what you use to stitch, bandage wounds, which will prevent wounds from reopening permanently. You only need one of these kits. It's not a consumable. If you scroll up, you have the personal aid kit. If you hover over that, it says. Oh no, never mind. Basically, that kit will reset the patient to full health. Remove any medical history, any restore everything. So it's basically like a respawn.
Just take loads of them, yeah.
No, you only need one. Not a consumable either, so you only need one. The purpose for having this kit, the person aid kit, is simply when to use when if someone's like being proper armored or something and just need to reset.
Okay.
Something's like gone crazy and you need to reset. Or if you like maybe you're in a mission where you've done one objective, gone home to base to rearm or regroup, whatever, and then you're going back out, then it's okay to use the first aid kit to top everyone off. Just reset.
I see. Okay. Yeah.
But it's not meant to be used out in the field as soon as you fix someone up.
Yeah.
If it gets abused, we'll just remove it. Same goes for the oh my game. Okay, same goes for the dressing vacuum, also in your backpack. Dressing vacuum NPWT. I don't remember what that stands for, but anyway, that's like a one body part pack. This one is also not a consumable yet. You only need one. This one is meant for the very most critical cases. I believe I'm hoping they're gonna add a setting for this where you can make it consumable, so you when you use it, it will be consumed, right? An example of using this is when you have a body part which has sustained a large amount of wounds, like we're talking about 10 plus avulsions. Then you use this item. Then it will bandage and stitch all wounds after a couple of seconds. So it's like the most critical cases. And I'll show an example of this later. Sorry, go ahead.
I was just gonna say, even then, you can still tourniquet an arm and fix that slowly if it's the torso. Obviously, it's more likely to be used on the torso than a limb.
Exactly, yeah. And you have you have the medications to treat multiple wounds as well, like TXA, EACA, and stuff like that. But I'll show you a very specific example that's in a minute, and that's I'll take it then. Anyway, let's see. We have right. No, we'll go that later. You have here's something special. You got the Reboa unit in your vest. Stands for a resuscitative endovascular balloon occlusion of the aorta. Basically, what it does is it's a catheter you insert in the right leg, and once that's been inserted, it will stop the bleeding in both legs. You also have the option to advance this unit and push it further up into the torso, and then it will stop the bleeding in the torso as well, along with the two legs. So this is perfect to use when it's like you got a massive hemorrhage going on, and you need to stop that. Obviously, legs you can slap on tourniquets and you're fine, but if you have a large amount of wounds on the chest, for example, this is good go to. I'll demonstrate it in a moment here. I think that was everything right. So we go through, we'll demonstrate the Reboa, and then we'll treat some pneumothoraxes. So, get a patient. Oh. It's not good. Give me good enough.
Oh my god.
Worst comes first,
Massive
kill. We can
bleeding.
make a patient.
Make a patient. This ain't too bad.
Can we start on him? Oh.
Arma. Arma. Wait for it. There we go. Ready? Here we go.
Oh.
Pascal just fucking shoot the guy.
Can we start him? Yeah, let's go. Tourniquets. Left arm, right leg. Check airways.
More bleeding.
Air suction. Oxygen removed. Check breathing. Not breathing.
Can you guys hear me?
Can now.
Yep.
Alright,
Yep.
fucking T4 is doing my head in.
Oh, then that might be the tourniquet that's
It's not
Right.
breathing.
Where does the Reboa
Okay.
show up?
I need to restart this because you couldn't hear what I was saying. 1 sec.
Oh. We were almost there.
We were close to that guy too.
Alright, don't touch him.
Not touching.
Right. If you now... Hang on.
Tell us when.
Oh my god.
Okay. So, if you go to the surgery tab, select this right leg. Oh, where the fuck is...
Surgery tab.
I don't
Back on
see an
chassis.
option anywhere. Oscar.
No, Damn, why don't I see the Reboa option?
I think it's
Oh, right, no. That's my bad, I forgot something. Right, go ahead and go surgery tab, select the torso, conduct ultrasound assessment.
all ultrasounds at the same time.
Yeah. When
Getting
you
a
see
second
that,
opinion.
Go to right leg, place Roboa unit. Someone else go ahead and tourniquet arms, please. When you have placed the Roboa unit, go ahead and advance the Roboa unit. Select the right leg again and then advance Roboa unit. Alright, good stuff. So, if you see now, he lost a fatal amount of blood loss, or fatal amount of blood. But you see, in the very top right of the overview, very top of the overview, you got no bleeding.
Yeah.
We have stopped all the bleeding right now. Now, should we remove the tourniquet, or let's say we only had bandaged the arms? If that would reopen, start bleeding, and probably die within seconds, because he's at the very edge right now. So, the Roboa stops all fluids in the legs and the chest or torso, which means you can't put in a fast IO and push fluids. Nothing will flow. You can, however, you can get cardiac activity going, but right now we would have to bandage one of the arms, and then remove the tourniquet, bleach the arm, and then push fluids. Same goes for
Can we push
medication.
fluids on both arms
You can, yeah.
to make it faster?
Yeah, but you need to bandage the arms and remove the tourniquets before you're able to push on the fluids. So this would be, if you look at the state of him now, right? He's all fucked. We got the Roboa place, we got the tourniquets on, we stopped the bleeding. Let's say his head had a bunch of wounds as well. And like an excessive amounts of wounds. That's when it would be a good point to use the dressing vacuum. So after we sorted this patient out, I'll show you an example of it. Right, so good, we got the fluids going. So, someone say extended the head, good stuff. Has someone checked the airway? That's not included.
Yeah, I already checked. It's okay.
Yeah, good stuff. Good stuff. So that was my bad before I forgot. So the ultrasound. That's something you need to use before you're able to use the Roboa, and there's another thing you can use it for. But when you use the ultrasound, you go to surgery tab and chest, and you go to conduct ultrasound assessment. That will tell you the status of the airway, the cardiac status, and the lung status. So it will tell you, as you can see in the quick view down there, it says airway status compromised. Cardiac status, if he was, it's strange that it says normal now actually, but it would say, for example, tamponade. Tamponade is an fusion building up in the heart, so it's affecting the cardiac activity. That's something you solve with a pericardial tap, as you can see if you go to the surgery tab. So what that will do is, let's say you treat someone, he's fully back up, and you send him on his way, and all of a sudden he just collapses, and he's in cardiac arrest. That could be a reason why, if he's suffering from a tamponade. So tamponade will appear if you suffered a deep penetrating injury, or DPI. That's what you see, the little red mark when someone's got a pneumothorax, for example. red marker in the chest. If it doesn't, if you suffer a DPI, deep penetrating injury, and you don't receive a pneumothorax from that, most likely you will receive a tamponade. So if you see someone that suffered a DPI, make sure you do ultrasound on me just to check for that tamponade. As I said, it will also show you the lung status. It will tell you if it's a pneumothorax present. Does that make sense? Are you with me still, or is it confusing?
Yeah, no,
Okay, good stuff, good stuff. Okay, it's about ready to wake up by the looks of it.
Where can we slap him?
Yeah.
Yeah.
Come on. Wake up, dude.
Check his blood pressure.
I got a flashback to other ops was there's no medics around. Just all I hear for the next 5 minutes.
Someone go ahead and check the
pressure?
blood pressure. Yeah. Yeah, it's good.
122/78. Yeah, it's good.
Yeah.
It's breathing again.
Right. So, how come it's not waking up?
Airway
Right.
is obstructed and airway is occluded.
Really?
Oh,
yes.
That's gonna be an issue.
How did we miss that?
So, oh yeah. So that was the thing, right? We noticed that it was not occluded. It was not obstructed because someone was doing hyperextending head, right? But that person probably moved away a bit from the body, so it cancelled, and maybe the patient puked. So he's pretty much stable, right? But he's not waking up. Why is that?
The rebuilt boa.
Yes, exactly. We need to remove the boa. So go to surgery
yeah.
tab, select the legs, and remove the boa.
I'm gonna keep slapping.
Slap
Well.
him! Slap, 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 slap.
So we got
Pulse
an
is
issue
gone.
right now.
Lost his pulse.
Yep. There you see when you check the response, not responsive, taking shallow gasp and convulsing, that's cardiac arrest.
Oh, yeah.
Someone stop the timer. It's a long 10 minutes that Deva.
Keep going.
I can't fucking open the menu. What?
He's not responsive. Come on, guys.
What?
Purely,
He's got a
purely
pulse.
British joke that was.
He's not
He's got a pulse.
responsive.
Not responsive?
His response. That is not.
He's got a pulse.
Got a pulse.
Yeah.
Stuff.
Slapping.
Now,
High
if
enough,
you
though.
really,
No,
if
no,
you
no,
really,
don't slap him yet.
if you're really professional right now, you stand by to slap him when you reach 80 in heart rate.
How do we slap him anyway? I don't see the button.
Reorient patient.
Select head, medications tab, and reorient patient. Go ahead and slap him now. There you go.
Hey.
All right.
D1 slap.
Yay!
Welcome
One
back,
slap
dude.
is all it takes.
All right. So,
Wait, let me take away my gun.
No, you don't need it.
You don't need a
Yeah,
gun.
no
Stop getting
guns. Only I'm allowed to carry gun right now. Right. So, I'll crack on. Time is flying by. So now we'll do some pneumothoraces.
I get to listen to this.
It looks very comfortable.
So let's see here.
You gonna shoot him or can we treat him?
Give me a second. Right. So yeah, you can treat everything but torso. You can treat the arms and stuff, legs. So you can see now. You see the red mark on the chest, right? Normally, it would say in the overview, deep penetrating injury, I think, or DPI. Or maybe I'll disable that. I'm not sure. Anyway, you can also see it says pneumothorax. And what tool did you have to treat the pneumothorax?
Death seal.
Yes, exactly. So we could check just for the hell of it. If you go to surgery tab, select torso, conduct ultrasound assessment.
Oh. If I do an airway suction without checking the airway, is that wrong?
No, you can do that.
Okay.
Sounds normal.
You can definitely do that.
Yeah, airway state is compromised.
Yep. Obstructed. Now, when it comes to the airway, a tip is when you check the airway or you're handling the airway.
Here we go.
Hey, he's awake.
Good stuff. Nice.
It doesn't
Said
sound like
slap
he's
him
got
a
a
few
memo.
times.
Yeah.
Slapping somebody really does work. 10 out of 10 method.
Yeah.
Highly approve.
So, one tip I can give when it comes to the airways is when you come up on someone and you check the airway, and you need to quickly check if the patient has a pulse. If he doesn't have a pulse, you know he's in cardiac arrest, and since you're gonna need to do CPR and or use AD or something, you can't put the patient in the recovery position. Hence, I would use the King LT right off the bat. But maybe you check the pulse and he has the pulse, then you know, all right, well, now I can use the hyperextension while I do some other stuff, and then I can put him into recovery position and I can save the King LT, right? You're gonna carry quite a few King LTs, but
Yeah,
just
they
in case you
single
run
use.
short.
They single use then the King LT.
Yes, yeah, single use. Right, so we'll go for the next one here.
Don't delete him.
So, no, I won't delete him. I'll just keep hurting him.
Don't hurt Pookie.
Alright. So, to select the torso, you see tension pneumothorax. That is, if someone knows, correct me if I'm wrong, but I believe that's when air is escaped into the chest cavity and is putting pressure on the lung.
So it's a sucking wound. And on it,
Yeah.
feel.
Yeah, so first, you always start, no matter what kind of pneumothorax it is. First thing you do, put the chest seal on. So go ahead and do that.
3 chest seals. That's good.
Yeah. Right. So, before we do anything, does anyone remember what you used to treat tension pneumothorax?
Needle decompression.
Yes. Go ahead and use that.
Which one? Needle decompression?
I like the sound they make with the tension pneumothorax.
Yeah.
The breathing
Yay,
sounds are
tension
fun.
pneumo done.
Yeah. I'll actually go. I'll can listen to that. I'll do it again. So you might see in the airway category, you got 2 needle decompression. One saying needle decompression, one saying NCD kit after it. Yeah, so the one that's saying without NCD kit, that is your AAT kit, the Advanced Airway Treatment Kit. That's why you got two options. You got two tools currently in your backpack or in your inventory that can treat this injury. Keep in mind the NCD kit is lighter than the AET kit, so it's good to have both actually. Save the AET kits for the hemothoraxes and use NCD kits for the tension pneumothoraxes. We get one hemopneumothorax, and before we treat this, I want you to go to Examine tab, select torso, and auscultate the or auscultate. Is that how you say it? Auscultate? Let's see. Examine tab. Oh, sorry, not examine. I mean airway management and auscultate lung sounds. You listen to that.
Oh yeah.
Oh, my ears!
Auscultate, yeah. That's the sound of a pneumothorax.
My ears! I will never recover from this.
Yeah. So, yeah, can go ahead and treat this. Going for the chest seal, and then as you can hear, it's crackling sound, and it's hemopneumothorax, so it's blood that's seeping out and wasn't the issue. So drain fluid. Yeah, good stuff. Alright, I'll have you listen to the tension pneumothorax as well.
Oh no. My ears.
Right, there you go. You can listen to that. That's another thing I forgot to mention with the hemopneumothorax. Since it means internal bleeding, you'll see they assess that the patient is bleeding, even though he doesn't have any visible wounds. That's another giveaway that now we can see that it says pneumothorax or hemopneumothorax, but should we ever be in the hardcore mode, it won't tell you in the menu that there's a pneumothorax present, so and it will be a bit of a giveaway if someone's bleeding without wounds.
Bleeding without wounds, they have some other wounds internally.
Yeah, internal wounds, exactly. Right. So, quickly show the dressing vacuum example. A second.
What was that?
What the hell?
Okay, incoming patient. Alright, look at this guy over here. Now, I need someone to place Reboa. Go ahead and do torso, surgery, conduct ultrasound assessment. After you've done that, you select the leg, place the Reboa, advance the Reboa. Someone else go ahead and tourniquet the arms.
Oh. Oh wait, no, it's fucking guns.
And legs, right?
Don't need to tourniquet the legs, since we're using the Reboa. We're gonna advance
Okay.
that up. Yeah.
Like, this guy looks fine.
Yeah.
Fucking looking at the wrong person.
Yeah,
So,
Robo's
go-
in.
Yeah, perfect. And if you look at the head now, we have 15 large avulsions. That's going to take a while to bandage and sort out. This is where you use the apply vacuum dressing under the surgery tab. There you go. Bleeding stop.
Yeah.
Now you can crack on with airways and just normal treatment. But so this item is for these kinds of situations, right? When it's like excessive amount of injury, and this is like the reason I would like to keep this is just to kind of keep the immersion a little bit, because this was just from a normal ID, and sure, like IDs should be fatal, but I mean they at the same time they don't have to be fatal, so there's a chance to save someone getting hit by this. Keeps everyone in the game. Right, so all the stuff we're going through right now. Any questions?
Nope. Not for me.
Not in here.
Okay, good stuff. Good stuff.
Next operation, we all gonna be medics.
Yeah, medic.
Christ,
Right.
I hope so.
Nobody's ever going down.
Yeah, hopefully not. So what we got this patient up. We'll go through the picture Delta posted in Arma chat.
Yeah.
Pulse rate 0.
Now we've got to bandage his legs and remove the Roboa before we went.
Yeah. Ready to remove Raboa?
We haven't got a pulse rate at the.
So yeah, so someone pushing TXA. The TXA won't reach the chest or head right now since there's no fluid movement. But if you remove the Roboa now, you can actually already banish it. Never mind.
Don't we give him blood?
Yeah, it needs a little bit of blood.
There.
There.
Copy.
Analyzing now. Stand clear.
What does the A stand for in smart?
Stand clear.
Airways.
Push
That's
to
airway.
shock.
Constructed.
Yep. How's
Clear.
that looking?
Well, no. Wait.
Clear.
Yeah. Yeah, gone.
Fucking. I gotta charge again.
Now. Stand
Yeah.
clear. Shock advised. Stand clear. Push to
Clear.
shock.
Yeah.
Push analyzed.
Stuff.
That 44 heart rate.
And climbing. Good stuff. Yeah, next up we're gonna have
Airways
fucking
clear. Breathing is slow.
got a low heart rate at the minute, but it's climbing.
Pick him up, yeah.
Slapped him! Let's go!
There you go.
I slapped him away.
Alright, good stuff, good stuff.
I am incredibly curious. It's in cardiac arrest if I shock him now, right?
Probably.
There's a chance for it, or risk for it to happen. Yeah.
That's perfectly fine. Man, that's crazy.
Right, cool. Okay, if you go ahead and everyone check Discord, check the picture that Delta posted in Armor Chat. Does everyone have that open right now?
Yeah.
Yeah, good stuff. So we start off with the pain management. CWMP, that's a combat wound multi-pill pack. That is the painkillers you ought to be using. Since those are cat medical based. The ACE painkillers are not, and the ACE painkillers can have some negative effects. Doesn't work with the cat pain the cat system, so it might cause some issues using those painkillers. So those are the painkillers you're gonna be using, the CWMP. Says 4 pills per item, so carry a couple of those and you're good. It takes about 90 seconds for it to reach max effect. So you might notice that the pain doesn't subside right away. It takes some time. After that, you got the Penthrox inhaler. All this is used by selecting the head and going to medications tab, and you got the options there. The Penthrox is a little bit more effective when it comes to pain. So if you have severe pain, you can use this. Hopefully, bump it down to regular pain, and then you can use some pills to to remove the pain completely. After that, you got nalbuphine. It's this is you need to have an IV or an IO inserted in order to push this, and that's a good pain relief medication. It has an opioid relief of 1.2. That means you have you're able to take a little bit more pain damage. Yeah, you can take a little bit more. You kind of like what's called, not drugged, but you know what I mean. Like you don't feel as much, so you can take some more beating. Yes, very slightly though. And you see, I forgot to put in. You see where it says 10 minutes, 5 minutes, 15 minutes. That's the time it stays in the body. The number following that you have says 6, 4, 2, 4. That is the max dose, where they will be the treatment will be for successful. The number after that, you got the max dose deviation, which means let's take Penthrox for example. So you have 4 doses you can use that will be successful. Then you can do another 2 doses that might be successful. They might not be. Any dose after that will cause an overdose. But yeah, you can read more about this in the guide. This is all like snippets out of the CAD medical guide, so you can find everything in there. The morphine auto-injector, as it says, doesn't need an IV or IO. It's an auto-injector. You can slap it in. This is I'd advise not to use morphine as much since it stays in the system for a long time. And sure, it's good pain relief. And you're thinking, well, if it's in for half an hour, that's good, right? Well, it's good until you get hit again, because when you start bleeding, you're gonna bleed fast. So that's the downside of that. So ketamine is as strong as morphine, but it has. Hang on. I'll be back 1 minute. Sorry. Okay, I'm back. All hear me?
Yep.
Yep.
welcome back.
Okay. Good stuff. Good stuff. Right. Ketamine. It's both ketamine and fentanyl has a side effect of causing chromatic or aberration, which is the distort looking color changing screen effect, which is annoying. So ideally you want to kind of stay away from these two. Ketamine has a good use if, let's say you actually, well, let's say you're treating someone that has used morphine, he's still unconscious, and you can't get him to the stable set of vitals to wake him up, because he has a low heart rate, low blood pressure. This is where you could use ketamine because it will give pain relief and will increase the heart rate and the blood pressure into stable ranges, and you can wake him up. And then the pain management is already sorted because you pushed the pain medication. But it is very rare that you use this one. At least personally, I'm just speaking from personally what I would do. Fentanyl is the most effective pain relief. It has an opioid relief of 1.5. The situation where to use this could be if you someone's been injured and you're in the midst of a firefight, you manage to like stop bleeding and whatnot. Patient is conscious, but you need to keep on fighting because he's in the middle of shit. So push fentanyl, remove all the pain, and you get a little bit of boost. Like you can take some more damage. That's the situation. I'd use fentanyl. Moving on. Any questions on the pain management, by the way?
Nope.
Okay.
Thank you.
Yeah, just shout at me if you want to ask something or anything. Bleeding and transfusion speed. You got these medications, all the, as it says, bleeding and transfusion speed. Phenylephrine decreases the heart rate, increases blood pressure, slows down bleeding and transfusion by 50%. This is an excellent medication to use when you come up on a casualty that has sustained a lot of injuries, and you need to buy yourself time to treat. So this would be if we have time, I'll demonstrate. But basically, think you push fast IO into the chest, push this and TXA, for example, and you increase the survivability for the patient by a lot. On the opposite side, you got nitroglycerin, increases heart rate, decreases blood pressure, and speeds up bleeding and transfusion. As you can see, they both stay in the system for 6 minutes, or stay in the body for 6 minutes. Let's say you push phenylephrine, you bandage the patient up, and you're just waiting on the fluids, right? But the fluids are really slow because you used phenylephrine. This is where you could use nitroglycerin. Nitroglycerin is half as strong as phenylephrine, so you had to use 2 nitroglycerin to balance it out. just keep in mind, this is kind of the same as the morphine. If you get hit again and you have nitroglycerin in your system, you're gonna bleed out a lot faster. Just keep that in mind. Moving on to some useful medication. Adenosine autoinjector decreases heart rate, decreases blood pressure. This one is could be useful in some situations. You're treating casualty and you manage to get a pulse oximeter on quite early. Patient is still bleeding and you're treating, but you see, putting on the pulse ox, you see the heart rate is very high, about to go into cardiac arrest, like at 200 level or something. This is where I would quickly push adenosine, just bump that heart rate down a bit, keeping from going to cardiac arrest, and continue treatment, because that's one step less you have to worry about later, right? So that's an example. Atropine, when we encounter any chemical intoxication, as it says, if you have an op when we're handling chemicals, atropine will treat any symptoms. Also, you see treats bradycardia. That's not relevant right now because we're not using anything that could be causing bradycardia. Bradycardia is when the heart rate drops by 40 beats per minute and stays that way for 20 minutes. It can occur, or has a chance of occurring when using certain medications, but most present when you have advanced heart rhythms active or enabled in cat medical. So it's not relevant for us at this point. Naloxone treats morphine, fentanyl, and naltrexone overdose 1-to-1 ratio and clears all the effects. So let's say you multiple people working on one patient and 2 of you accidentally push fentanyl. This could be then it could be good to use naloxone. Just remove one of them. Coagulation. TXA, as I explained before, it bandages up wounds when you have it in the system. Stays in the system for 2 minutes. It will not reach body parts that are tourniqueted or reboaed. EACA stitches bandage wounds, also inserted through IV IO. And same thing there, won't reach tourniqueted and reboa limbs or body parts.
I think Guns just went unconscious.
Oh, yeah. Well, we'll save him later. Right, so wake-up medications, we're going through that. Ammonium carbonate. You see it has an overdose effect. I think that might have happened before when the dude went into cardiac arrest again. But yeah, 10 to 12 uses for going to overdose.
Yay, Guns is awake.
Oh, was it Guns that collapsed?
Yeah, I just had to slap him a few times.
Oh. I'm not in game right now. Alright.
I just fucking collapsed over, slapped him a few times.
Let's do
maybe that heart rate of 56 ain't exactly great.
I healed everyone, I hope. Right. Last bit here. Oh yeah. Epinephrine auto-injector. You can see increased heart rate, increased beat, blood pressure, boost wake-up chances. Also, stamina drain rate is reduced by 50%, so it's a bit of a stamina boost. It also slows down bleeding and transfusions by 15%, but I would not use epinephrine for that purpose. Yeah, it's just beneficial in some cases, I suppose, but yeah, mainly used for wake-up chances or trying to get cardiac activity back. Right, so these are some medications and that we use and are useful. There's more stuff, more medication, but most of them are not relevant for us right now with the current cat settings we have. But yeah, there's a bunch more to read in the cat official guide if you would like. Right, so you're pretty much out of time. I thought I'd do one last thing, but yeah, any questions on any of that?
No, I don't think.
Done.
All right. There was something more I was gonna go through. I forgot what it was. Does anything feel unclear or something you confused about or no?
I think so. It's just going to be practice.
Yeah, yeah. So yeah, you always got this medical area available. It's use it is great. I spend too much in here, to be honest. Let's see. I need to do some editing, but I'll post up a little bit of a document in the next few days. But until then, you got the CAD guide if you want to take a look at it. Yeah, just whenever we're on, if I'm on, or maybe Nagi or other people, just jump in here and do some practice, some medical workshops. Yeah, I'm sorry, I completely forgot what I was gonna do for the last bit, but yeah, I think we covered most of it. Time fucking flew by, so as I expected, it's a lot to cover in
Yeah.
2 hours.
Yeah.
Yeah, yeah, I believe that's it then.
And from now on, no one dies.
I would recommend, guys, just go and save the 2 kits that Fast Kills made. Just because then you can fall back on them if you are practicing your medical stuff.
Yeah, that's a good shout.
Thank you, Pascal.
Yeah,
Yeah,
no
thank
worries.
you, mate.
Thank you for attending. I'm glad so many of you showed up. Oh,
Yeah.
thank you. I felt a bit rusty doing this training, so if you have any feedback or anything you wish me to take up or bring up at a later point, so do tell.
Bit unrelated, but I was curious about something.